Because sometimes there's a clue. And in your case, you found that clue. Your seizures are related to your monthly changes in hormones, right?
And he's probing around in her brain and he hits a nerve and she says, "I smell burnt toast, doctor," and she's all excited in the middle of the surgery. So
right now, you're going to wait months and months and months unless you have a surgeon or a specialist who will fast track you. That's just the way, because our healthcare system has officially collapsed.
I was supposed to have an MRI on the Saturday, but she had 5 seizures the day before.
He didn't know I was behind the wall, and he said she shouldn't wake up for a week. We give her enough vials, whatever.
The reality is you could dial 911 and you don't know if it's a red alert, or you'll get an ambulance in a reasonable amount of time.
This is a politically centered podcast.
hello, ladies and gentlemen. My name is Jeremy Silver, and this is a politically centered podcast. This is our continuing journey through the Alberta healthcare system. Under the leadership of Premier Danielle Smith, the United Conservative Party of Alberta has made enormous changes to the Alberta healthcare system, moving to a dual public privatized healthcare platform. Now, I'm not a healthcare expert, and I'm not going to start this podcast off by saying that it was a horrible, bad idea, but inevitably when you make drastic changes, people fall through the cracks, especially when people have to evolve with those changes. Today on the Politically Centered podcast, we have 2 returning guests. Our first guest is Ali Morrison. Ali Morrison is a healthcare advocate that runs EMS Safeline. She's advocated enormously in the provincial government for local citizens and has been tracking the healthcare crisis that has hit Alberta since the changes have started. This is her second appearance on the Politically Centered podcast, and we hope that she'll be coming on in the near future. Our second guest making his second appearance on the Politically Centered podcast is Dr. Andrew Wilner. Dr. Andrew Wilner, who is also a board-certified neurologist and runs the Art of Medicine podcast, is currently practicing out of Memphis, Tennessee. He's given us his enormous wealth of knowledge and skills over the years to help the patients in the Alberta healthcare system try and navigate their medical issues, and Ali Morrison brings up the advocacy end. I would like to introduce our guests for today, Ali and Dr. Andrew Wilner, as well as the patients they'll be talking to. As usual, I'm going to leave out their last names for privacy's sake. Today on the Politically Centered podcast, we have Misha. Misha is our patient, and well, she brought her entire family with her. Misha, go ahead, please. Dr. Wilner and Ali Morrison are both here to help you out today, so please take it away.
I've been having a very, very a hard time, let's say, with the Canadian Alberta healthcare system.
What's been happening a lot with her is that in the beginning, when she first got it, most of the doctors that we had were just, well, here, let's put you on this pill. Okay, well, that's not working. You're still having seizures. Well, let's up the pill. We'll up it because we can up it up until 1,200 whatever they said. And then once that still didn't work and she still kept having seizures, they're like, all right, well, we'll just add this other pill. And then we'll add that one. And then we'll just keep until to a point where she took off all her clothes and went naked in the streets and chased vehicles.
I went crazy. I basically went nuts. I thought there were cameras in the house. I thought that everybody was following me and against me. I went nuts. It was very crazy. The medication made me go nuts. And so I won't take any more medication anymore because all they do, it didn't help. It didn't help. I was still having, it seems that my seizures are just once a month during my periods anyway, and it just won't help. And so, the doctors just wouldn't listen. And
Okay, let me tell you a little bit about myself, and then I'll ask you some personal questions. Is that okay?
Yeah, absolutely.
So I actually did my neurology training in Canada at the Montreal Neurologic Institute, and I did an epilepsy fellowship there for an additional year. Um, and subsequent to that, I went into private practice where actually I treated thousands of people with epilepsy. I wrote a book called Epilepsy 199 Answers way back in 1996. That's been, I think it's in its third edition now, that you definitely ought to check out for some background information. That book came out before you could go to the internet and ask, FAQs, but that's kind of my take. Now, when I trained, there were only about six medications for seizures. I'm not sure which one you tried, but now there's over 20. And the broad statistics are, I mean, it sounds to me like your doctors actually did exactly the right thing, because the broad statistics are that for all comers, patient comes in with epilepsy, that 1/3 of them, so 1 out of 3, will have their seizures completely controlled with the first medication that you prescribe, and you're good. Another third will be prescribed with something different, maybe a combination of two medicines or higher doses. And then there's another third that no matter if when you do all the simple things, the seizures don't stop. And that's what we call intractable epilepsy or refractory epilepsy. And those are the patients that turn up in the emergency room and frequent clinic visits and have a lot of personal misery because they can't get this thing under control. So when I see a patient with seizure disorder, there are really two big paths that I have to follow that are very closely related. The first is, why is this person having seizures at all? In other words, what is the underlying cause? And if I can find that out, which usually I can, but not always, then that's going to help me control the seizures, which is the second goal, right? So, goal number one, why is this happening? Goal number two, let's make it stop. And those are very closely related. Now, some people may have normal examination, normal EEG, normal MRI, everything's normal, and yet they still have seizures due to some wiring issue that's way beyond what we can understand. Maybe genetics, maybe environment, some combination. And we call that cryptogenic epilepsy, like crypto. It's mysterious. We don't know. So we just treat it pretty much with trial and error. If, on the other hand, we find a brain tumor or a malformation or something that's abnormal in the brain that we can fix, then that would be the goal. And then sometimes there's an abnormal area, seizures are due to abnormal electrical activity. And sometimes there's just one little area that's just not functioning properly. And that actually can be treated specifically, often with surgery, without affecting the rest of the brain, and often with a really good outcome. And so when I trained way back in the 1980s, there was this new concept back then of a comprehensive epilepsy center. And that was to create, just like we have cancer centers, that there should be a center for people with epilepsy, because there's a lot of things that need to be addressed. There's psychological, there's surgical, there's electrical, there's neurological, there's medication, there's social. How do we get this paid for? Where do we go to get the best treatment? And so there are comprehensive epilepsy centers. Now there's, I think, way more than 60 in the United States. I'm not sure how they're distributed in Canada, but I'm certain that in Toronto and Montreal there are epilepsy centers. I'm not sure in your neck of the woods. I would suspect
Not
in
too
Vancouver
much.
there would be also.
Ali Morrison, are you aware of any similar center in Alberta? Oh, you're on mute, Ali.
Sorry, I'm personally not aware of this, but I'm going to Google right now and see there should be one in Edmonton, possibly at Calgary. So I'll just look now and find out and let you know.
Oh, and let me mention in your particular case, you've identified, we always ask patients to keep a seizure calendar.
Yeah.
How often are these happening and when? Because sometimes there's a clue. And in your case, you found that clue. Your seizures are related to your monthly changes in hormones, right? You've
Hmm.
seen that. Now, all of them may not be that way, but it sounds like most of them are. And
95% of them.
yeah, so that's fantastic in the sense that that gives an opportunity for directed treatment. There are experts in epilepsy that focus exactly on that, on hormonal changes. It's a well known phenomenon that some women, not all, in fact, it's a minority of women, but some, for reasons that we don't fully understand, do have seizures related to hormonal changes. And we even see changes in seizure frequency in pregnancy, for example, when obviously the hormones are different. But what you have, and there are specific treatment approaches for people like you. And someone, an epileptologist, a neurologist who has had additional training in epilepsy, like myself, would focus on your calendar to see what interventions you might make um, that could help you. The other thing is, I wouldn't write off all medications because you had a bad experience with one. There are patients who do have a very untoward experience with one medicine, but a different one, perhaps one that works differently, may have very good results with a totally different side effect profile. So I wouldn't be so categorical to say, well, I'm not taking any more medicines because that one didn't work. Because, medications are very, very different these days. As I said, when I trained, we had half a dozen. Now we've got 20. And some are in the same family, but some are completely different. So, and we try and tailor these to the person's particular type of epilepsy, and in order to figure that out, back to my original concept of the two paths, we usually do MRI of the brain and a brainwave study, EEG. Did you have those?
Once, just once.
Well, MRI once may well be sufficient, and I guess they told you it was normal.
Um, there actually, they said there was a blockage once in
Well,
the left part of my temporal lobe.
oh, well, that might
They
be
did
a
want to,
target.
yeah, yeah, they did say that once. And they said they wanted to do a surgery, but I was like, no, that's okay.
Well, surgery is not usually your first step
Yeah,
unless it's a brain tumor. In other words, unless that
no.
tumor needs to come out, then it's got to come out. But if it's something causing, if the only negative thing is the seizures, we do have other approaches. And it sounds like you're
Hmm.
really kind of very at the beginning of that. But, an epilepsy specialist like me
Hmm.
would be very excited about your case because we've already learned that there's a monthly cycle and that there's an abnormality that may be a target for treatment, either surgical or some other way. So if you came into my office, from a doctor's point of view, if I see targets where that I understand, that's very exciting to me. If people come in, their MRI is normal, their EEG is normal, or having lots of seizures, I don't know where to go with that. But with you, I've got some clues. So I
Hmm.
would think an epilepsy specialist would be very enthusiastic about your case.
How do we
Dallas,
find one of
Misha,
those guys?
actually, I want to
me,
bring Dallas in here. Dallas, you are Misha's mom, and yeah, I know you've been helping her out enormously with her medication and with the healthcare process. So, what medication was she on? I don't think that's been addressed yet, and maybe Dr. Wilner's familiar with it.
I don't know if
well,
mom will
she started.
remember.
I don't remember all of them, but she is still on epilepsy medication, and it's Topamax. And then the rest we have quit because they didn't help. And Misha was just so manic with all of them that Misha. Misha decided to stop them, which stopped the. It was really a funny thing, which stopped the seizures for 6 months, right, Mish?
Yeah, it did
And
stop for
then
6 months, but then all of a sudden they just started again.
started again. But right now, Misha is really affected prior to her periods, during her periods, or after her periods. Misha has had MRIs, she's had EEGs, she's been to the epileptic clinic in Calgary. Mostly she just had focal seizures then, and we left. The doctors right now do not think that it has anything to do with her menstrual cycle. We have mentioned it to many doctors, haven't we, Mish?
Mm-hmm.
Many doctors, and they do not think it has anything to do with her menstrual cycle. So right now we are going to take Misha, or we are starting with Misha, to go to a bioidentical hormonal specialist to see if it is hormones in her system. So what does the doctor think about that?
Well, it sounds like it's a complicated case. If you do have an abnormality on your MRI, then that has probably attracted the doctor's attention more so than because if you have seizures before your period, during your period, and after your period, it's pretty much all the time. And it may be that your period lowers your seizure threshold because of that lesion in your brain. In other words, that's what's causing the seizures. And as your hormones change, they're going to be provoked. So fussing with your hormones may help, but if there is an abnormality in your brain that's causing the seizures, and we could normally determine that with the MRI and EEG and other testing, eh, no, it's going to be very, very challenging to stop all of your seizures with hormonal manipulation. So because what you told me is like this is obviously hormonal related, but in other words, a brain lesion trumps that. I guess it's the way to
Mm-hmm.
put it. It's unfortunate use of words, but it's more important from a pathophysiologic point of view. So I guess
Mm-hmm.
I would need to know what that showed in order to. I mean, there's no harm in seeing this hormonal therapy, and if it works, that's great. I mean, brain surgery is a big deal, but these days, I mean, it was pioneered about 100 years ago by Wilder Penfield at the Montreal Neurologic Institute, where I trained. He had already died by the time I started there. So this is something been done for a long, long time, and it's very, very sophisticated now and quite safe. Um,
We actually
so
have part of our history videos that used to air on our local broadcasting network, the CBC. And there's a famous one that everybody still quotes where he's probing around in a woman's brain who has seizures every time she smells burnt toast. And he's probing around in her brain and he hits a nerve and she says, "I smell burnt toast, doctor," and she's all excited in the middle of the surgery. So we're
Mm-hmm.
all, yeah, that must be the what you're talking about.
yes, no,
Yeah.
that's exactly. In fact, every medical student learns which part of the brain controls which part of the body. There's like a human, they call it the homunculus. There's like a map of a person in the head, which controls, there's a little part for the mouth and the tongue and the finger and the arm.
For those
And
of
it
us
was
who can't spell humongous, right?
and and it was Wilder Penfield who made that map. He by stimulating, and how about over here, like boing, oh okay, that must be the arm. He mapped it out in great detail, and every medical student even today still uses that map that he made. I think it's got to be 75 years ago, something like that. It was a long time ago. When I mean, these days you need a lot of permission to go poking around. Those days they just kind of did it. But the map is a great map. So there's been a lot of progress, in terms of microsurgery, where things are done in a sometimes they can use radiation, sometimes they can use ultrasound, sometimes it's laser therapy. Everything is designed to limit the surgery to just that abnormal part.
Mm-hmm.
So I would, stick with your epilepsy center. Those in Alberta, Calgary, they should know what they're doing there.
Hmm. It's been a while since I've been to the epilepsy center actually and seen the actual epileptologist
That's
there.
it, epileptologist. Yeah, I mean, because 50 years ago, this would have been a lot more challenging, but it sounds like they've actually got something to go on, and you're otherwise looks
I'm
like a,
looking to go get another MRI to get that actual checked out. It's been because I got it was when I first was diagnosed that they had
Mhm.
that was first
Right.
checked.
Well, I would let them do that at the epilepsy center because all MRIs are not created equal.
Hmm.
Ali, I want
And
to bring you in here. I'm so sorry to cut you off, doctor, but Ali, you gave a
Yes.
thumbs up when
Yeah.
he said Calgary, so
Yeah.
there is one in Calgary, I'm assuming. What is the
And in
average
Edmonton.
wait time in the Alberta healthcare system at
ah,
the moment
mhm.
for
Yeah.
an MRI?
Yes. So right now, you're going to wait months and months and months unless you have a surgeon or a specialist who will fast track you. That's just the way because our healthcare system has officially collapsed. So my question first would be, do you have an active medical team working with you that you have access to when you need it? Because some people have no specialists and they're
Misha
waiting.
was supposed to, sorry to interrupt. Misha was supposed to have an MRI on the Saturday, but she had 5 seizures the day before, so we just couldn't get her there. So I have requested for another rebooking of an MRI, but the first time the MRI was broke down, and then she had seizures, so it's just been an ongoing thing right now.
But does Misha have an active medical team that she can call and be
No,
get access to?
no, it's just my family doctor that's been
Okay,
Well,
requesting the MRI.
okay,
we have Dr. Maniselvo
okay.
Yeah.
is the one that requested it.
So right now, we do actually have, I don't know where you live, but there is the Calgary Comprehensive Epilepsy Program at Foothills Medical Center. And in Edmonton, we have the K Edmonton Clinic for Epilepsy. So I would
That's
suggest
Foothills. Yeah.
that you try and get into one of those clinics. Again, the wait times are astronomical. Sometimes there's a small chance that if you present to emergency, someone there will actually get you in a little faster. But the reality, the sad reality is that everybody, no matter what your condition is, it's a crapshoot right now, whether you get in
Hmm.
or how long.
Is
But
there any
we have found that if you can connect to a surgeon or an epilepsy specialist that can pull some strings, you might be able to get in quicker because you had to cancel for a valid reason. You literally have to do the work and call the centers every day and say, is there a cancellation? And it's worth doing that. I myself got in for an MRI because I was waiting 12 months, and they said to call every day, and I got in the next week. So it's
Hmm.
one tactic. If you can have a team of people phoning for you every day, just calling the where you're booked and say, do you have a cancellation today?
Okay.
And they want to help. They do want to help you.
Hmm.
So
Or
that's what I would
if
suggest right now. And then after I can talk about a few things that you can do in the meantime. But I'll put you back
Do
to
you have
Dr.
if
their phone numbers?
if I could just, I'm the dad. If
Richard,
I
go
could
ahead.
intervene for 1 second, we are not opposed to paying or going down to see this doctor, this gentleman that's a specialist in the States. If he thinks that he says it's an interesting case, if he would be so interested, we are definitely not opposed to paying to go down and see him if he was so inclined. But that would there be up to him. That's just me as a dad saying. Okay, I'll let you finish. Sorry for
That's
intervening.
okay. No, please. Add as we Dr. Wilner. How feasible is that for them to come see you, or would you suggest the same course that you suggested to our previous guest, Kim Johnston, and that would be to contact the Mayo Clinic?
Ah, so my role right now, I used to be the medical director of a comprehensive epilepsy center. I did that for 8 years, and if I was in that role, then that would be a reasonable approach. But I'm not in that role now. I'm a professor of neurology, and we don't have the same kind of epilepsy resources where I am now that I would encourage you to visit. However, my response, I think, is would be transferable to pretty much anybody else in that kind of situation. In other words, at an epilepsy center, and famous ones. I mean, you should geography may play some role also. The Mayo Clinic in Rochester, New York, the Cleveland Clinic in Ohio. I mean, those are very, very famous. There's a very good epilepsy clinic in Detroit. I'm trying to think of Seattle. What I'm not sure, what is more feasible for you, because obviously it's going to end up, because the evaluations are not one day. Usually they have you come into the hospital for a few days to monitor your brain waves and their psychological assessment. So the family is kind of stuck, sleeping across the street at the hotel. It could be expensive, but it might be something, it might be, depending on what your situation is in Alberta. And the other thing is, I don't know, are you allowed to, I'm sure the people in Montreal would be very enthusiastic, and in Toronto to take you on as well, since you're a Canadian. But I don't know how the provincial, what the rules are about the provincial health system and what province you need to be in and so on. But that might be more practical in terms of covering the costs, because
Yeah,
the
I
were,
was thinking about Montreal from your previous comments that Montreal is world renowned based on what I know. So that would be a lot easier than trying to go into the United States right now. But they actually do deal with patients directly at the institute.
yeah, oh yeah. I
I'm
mean,
just laughing at your
Montreal,
reaction. I'm sorry.
well, I don't even know, getting a visa. Yeah.
If I could just intervene for 1 second again, I think, Jeremy, a lot of this podcast was on the health system and about the Alberta health system, on how we're navigating it. We're finding that the doctors and the ambulance service have a set of rules that they can't deviate from. And what we're having trouble with is if Misha just gets in an ambulance, they, even with a green sleeve, we call it in Canada, I presume it's the same, they have to follow their same protocols, whether it's in the ER or whether it's in the ambulance, and they can't deviate. And as soon as Misha is tied up, as soon as she gets a little agitated, they tie her up. And as soon as she doesn't calm down, then she gets a needle. As soon as she gets to the hospital, they class her, and we've been through this. They class her as agitated, and we have to calm her down. As soon as they start shooting her up, I was behind a wall, and the doctor, the one time that we had the extremely bad experience, he didn't know I was behind the wall. And he said, she shouldn't wake up for a week. We give her enough vials, whatever. And that threw her into a traumatic experience. Then we had to go to Fifth North to get her straightened out for weeks. And it was just something that we don't, and it's only because of the system, because they got to go by their playbook.
For
And what
clarification,
we're,
Dr. Wilner, 5 North, 5th North is the local psych ward at the Medicine Hat Regional Hospital.
yeah. So what we're trying to do is, with Jeremy and with the doctors and with the ER people up here, trying to change. And Misha herself is trying to change the medical system on their views of this disease. And that's enough, my wife said. She said that's enough. So, okay, I'll let you guys. Yep, okay.
The thing is, it's just that it's not good for her. They don't understand epilepsy. That's the only thing that I'm going to say. They just don't understand epilepsy. And after she comes out of it, there's certain things that she does. She walks around. She doesn't know what she's doing. She has to go to the washroom, and you cannot interrupt any of that because she gets to aggressive behavior. So then, therefore, we just let her do what she needs to do until she's fully with us. And then, so that's why we don't call the ambulances anymore and stuff, is because that doesn't work.
Ali,
Yeah,
you wanted to oh, I'm sorry. Dr.
I was
Milner,
just going to say
go ahead.
that your experience there is not, well, there's a few parts to this, but one, people that have seizures very often in what we call the post-ictal state, in other words, immediately after a seizure, can be confused. and they can do all kinds of unusual things, and they don't like to be interrupted. And so one of the first things that we teach in seizure first aid is is not to restrain the patient.
Well,
You
that's all
only
they do here.
restrain them.
That's
Oh,
the very
I mean,
first thing that they did here.
right. Well,
And
only to the
I
extent to
had
protect you. But, in other words, if somebody's going to walk off into the road, you got to restrain them. But otherwise, you try and give
they
them some
weren't doing
space.
that wasn't the reason they were doing it. They were doing it to give me medication.
Yeah.
It was in the
That's,
hospital. This was in the hospital. This was in the hospital. They
No, that
we
that
went
was in the
together.
house here. In the
Yeah.
house
yeah.
here. Yeah.
Unfortunate. Yeah.
Yeah.
Um, and so what I was trying to say is that what is happening to you is not at all unusual in terms of having a seizure and being confused. And I was going to suggest that you don't necessarily have to go to the hospital for each seizure. The rules are generally, if it doesn't stop in a minute or so, then you got to call we call 911. I don't know what you call in Canada.
Yeah,
Uh,
911, yeah.
is it 911?
Yeah.
And also, there are what we call rescue medications, which are available, which are like Valium or something similar that you can squirt up the nose, kind of settle things down, and you'll go to sleep for a while, but the seizures stop and everything's good, and it
Yeah, they
saves an
give me
EM.
Ativan and then I
Yeah,
go to sleep. Yeah.
right. But that we usually give that in the vein. There are now sort of things you could
No, they
have at
give me
home.
a pill.
A pill.
Yeah.
Okay. All right.
Usually
Um,
after I'm usually somewhat more conscious and they say that I can usually take it.
you do that at home.
Yeah.
Okay. That
Yeah.
sounds like a compromise. Yeah, so the sooner this can be dealt
So that
with.
I don't go to the
How,
hospital.
how, like, is
Yes,
that,
sir.
should we not be doing that?
No, no, I think well, a spray's better because you don't have to swallow it. And when you swallow, you can
So I don't
choke.
because I could
Wh-
choke. Yeah.
Right.
I could
So the
choke on a pill.
spray is
Yeah.
a little better, but the
Yeah.
pill is a lot better than going to the emergency room and having all of these unfortunate experiences because normally
What
you're
would
going to wake up afterwards and be
what
more
would
or
the
less.
spray be called?
Well, I don't know about I would just ask for a rescue medication that you squirt up the nose. And it's the same family as there's several of them that are marketed in the US. I'm
Okay.
not quite sure about
Maybe
the
we'll do that then.
So
but
Misha and Dallas, you both at this point have verbalized to me in prior conversations that you actually refuse to call EMT or contact the hospital at this point. Ali, you've probably heard things like this many times. I've heard personally from people in Edmonton saying, "I don't even dial 911. We just get in the car and we take our chances." How widespread is this, and is how many people is it impacting from your perspective?
This is a good point. This is happening everywhere, every day, because the system has collapsed. The reality is you could dial 911 and you don't know if it's a red alert or and you'll get an ambulance in a reasonable amount of time. But I would say to Misha that unfortunately, all the people who are suffering like yourself are victims of the system that is collapsing. And it's awful and it's wrong. But regarding the EMS, they would have to restrain you in a truck if you were agitated for your safety and the other medic's safety, because they're speeding to a hospital and we can't have things moving in
Yeah.
those ambulances.
Mhm.
The other thing is they're doing their best and they're trying to call doctors to explain the situation, and they can't get through the line. There's no doctor. There's supposed to be a doctor at the Emerge online at the moment that you collect a patient who's in critical condition. So the system is so messed up. It's as I said, it's a crapshoot. But there
So
are
what do you
things that you
do?
can do. So I would ask, have you got a card that somebody hands to the medic who comes?
Yes.
And
Yes,
that
I
they
do.
and that do they list the behavioral results of?
Yes, they do. Yes,
Okay.
it does. Yes.
You've got to have somebody with you who will say, you've got to read this.
Yeah.
But the problem is because the hospitals are all overcrowded, the emergencies are chock-a-block. To have a patient wandering around is compromising your safety as well as everybody else in there, because basically the hallways are stacked with people waiting to get in. The waiting rooms are stacked. There's not enough cubicles to see people. So you're on a stretcher as well as other people. So to have somebody going down those halls and everything, it's just not going to happen that they're not going to try and sedate you or keep you there because of your safety, because there's people who are having drug overdoses, there's having people flipping out, there's violent people on drugs, there's people who are waiting for surgeries. So it's an awful thing that you have to be sedated that long. But the fact is,
Well, that's why we don't call 911 anymore.
yeah, in the long
Yeah.
Because
run,
we don't, was just
And I don't want to
Right.
do that to other people either.
strapping Misha down will just make her situation worse and harder and longer for her to recover.
And for other people too.
So just leaving her home and just watching her while she roams around is the best situation for her right now.
right. And if you know that you are going to come through the end of that seizure okay, that's valid. But there may be a time when you don't know what's going on.
Dr.
So,
Wilner, where is the middle ground here? This is, I mean, that, yeah, because that's what I'm hearing is, I understand that they have to restrain her to keep her from hurting herself. She's delirious at the time. She's incoherent. She doesn't know what's happening. She already said at the beginning that you actually ran out of the house completely naked in a panic, which in hindsight is terrifying. But then
That was
there's-
under medication.
Actually, what had happened, that was a direct cause of one specific type of drug that she was
Yeah.
on.
I see,
And
that
Yeah,
wasn't
that
the
was-
seizure
she went-
directly.
and
Sorry.
she went outside and started yelling at the cars
Yeah.
and then took her
Yeah.
clothes off.
Yeah, that wasn't under seizure. That was under medication only.
Okay, okay, I
That
understand.
wasn't cause of symptom of seizure though.
And yet,
Just to- just to
holding
make clear.
patients down in the middle of a seizure, Dr. Wilner, you said this can worsen the seizure, right? So where is the compromise here? So if worst case scenario, if she has a seizure in the middle of the street, someone dials 911, where should our EMTs get to?
Yeah, this is a big problem in psychiatry, right? When you have people with behavior abnormalities and that they can't control, and the response is to sedate them, which is not what anybody really wants. So I think what you're doing by keeping the seizures, managing them at home when you can is a good thing. I think asking for this rescue medicine, which they should be familiar about, that may also help because you never really know how long a seizure is going to last. And we always tell patients if it lasts more than 5 minutes, call 911. It's a little arbitrary, but most seizures almost every seizure will end by 2 minutes. It's done. No more jerking, no more, shaking or whatever the manifestation is. Now, you may be confused for a whole lot longer than that, but the seizure itself should stop. And if it doesn't stop, you can try rescue medicine. And then if it doesn't stop, well, you got to go to the hospital. In terms of when you're outside, you're at the mall, some people will have a necklace or a bracelet that says I have epilepsy. So at least you got that down because you mentioned you act intoxicated. I have heard stories of, patients being arrested because they were acting intoxicated when they had just had a
That's what I
seizure.
worry about.
Yeah.
It's interesting because epilepsy
I
is
also
not
have it
that.
on my phone and I also have it on my other things just in case
Yeah, I think that's
anybody
great.
comes across.
Is that a medical alert you have on?
Yes.
It is. Okay.
And there are watches that will alert your, whoever you want to alert, whether it's a family member or something. I'll send a text. You have one of those?
We're looking into that one right now. We still haven't found a proper one here yet in Canada.
Yeah.
That's I've noticed that in the States. Wow, you guys got the technology pretty much down pat, but up here it's still.
Actually, I believe Dallas and Richard had asked for my technical expertise to try and find a watch, and I looked high and low, and resources were very few. Dr. Wilner, is there anything immediately off the top of your head that you can suggest that I would be able to help them out with, to purchase a watch from the United States?
Well, there are such things. And I think even Apple Watches, the Apple Watch will tell you when you fall, for example, and it'll send a message if you fall. Mine's gone off a few times when I've tripped, and it says, "Are you okay?" Or should we send, let somebody know? And it's like, yeah, I'm okay. I was up to speed on the latest one a while back, but not right now. So I can't make a
Hmm.
specific recommendations, but probably a quick search will land you on something that isn't too expensive.
Hmm.
Um, but there's also the companions, the seizure dogs. Those are very
Hmm.
expensive and hard to get,
Yes, yes,
but
yes.
that's kind of another approach. I would encourage you to take at least one medication because what we found with patients is that even though the medications may not completely control the seizures, sometimes, very often, I had patients, I don't want to take this medicine, it's not working. I'm still having, 2 seizures a week. But what the patient doesn't realize is that without that medications, they'd be having seizures 5 times a week and they would last longer and be more serious. So the medication may actually be diminishing the severity of the seizure. So I would uh, encourage you not to go cold turkey on the medicines because even having a medicine on board that doesn't work, it still may be working a whole lot better than nothing in terms of protecting you and limiting the duration and the intensity of your seizures. I mean, it's hard to prove that except by trial and error, but we don't really want to go that route, right? We'd
Ali, how
rather.
feasible is it right now to actually get a service dog? I'm assuming this
Yeah.
is not covered by Alberta healthcare or any
Um,
provincial system.
no,
No.
it's not. The individuals have to do that. And I was going to bring up the search, service dogs. Misha, a student of mine in Ireland, a 12-year-old boy had a service dog, and that dog was with him every day, every moment of the day. And he had the equipment. He could tell in advance when a seizure was coming. I don't know how they know, but they're doing incredible work with these animals,
Hmm.
and would be there and could set off an alarm to people so that they would come
Hmm.
immediately. So
Hmm.
I can look into that for you. I don't know who's training them here, but I know from personal experience of my student that this animal is life-saving. And the
Hmm.
boy was being able to live a semi-normal life at school and in his soccer team and things like that with that dog there. And the other thing is that that dog can also give the people who are with you all the time a little bit of break if they have to run out and do those
Hmm.
things. So it's going to help everybody with that. The other thing that I want to ask is, well, first of all, I would say you need to get a specialist as soon as possible. So I would start with the ones in Alberta and then try and get into Montreal. I agree with Jeremy. They're groundbreaking work there. But the second thing is, there. Have you joined? I mean, maybe you've done all this, but have you joined any of the epilepsy groups and associations? Because really, you should not be alone in this. You may not be a group person, but you're going to get a huge amount of information from the other people who are living with this that you may
Hmm.
not have any other way, that the
Hmm.
doctors don't necessarily know or talk about, and even things that happen to you when the doctors might say, no, that doesn't sound like the epilepsy, the patients might reaffirm that. So you're not alone, and you can form bonds with these people who've been through this, who are living with this, and it's a great source of information, as well as just reinforcing that you're okay, you're going to be okay, you're not, I mean, you have this condition, but people are living with it, and you're not alone. You're not a
Hmm.
freak. There's nothing,
Hmm.
there's not something really awfully wrong with you. You have a condition, and you can bring it down to that level of believing that there will be treatments and it's, that are helping other people, and you will be able to, at some point, live better life than you're living now. So I would ask you, and you can contact me afterwards and I can give you the information of these groups. The second thing is there are organizations. Where do you live?
Medicine Hat.
Medicine Hat, okay.
Yeah.
So I don't know if Medicine Hat has a Helping Hands group or anything like that, but there
Hmm.
are organizations that we can find out if they're there. And these are volunteers who, say your partner needs to go to an important meeting or a doctor appointment or dentist or something, walking the dog. And those Helping Hands organizations will bring somebody, and they'll make sure they know what to do, and you can train them, you can tell them, and they can spend time with you so that your partner or your parents can have a break if they need to be away, because it's got to be absolutely terrifying for you to be on your own. And those organizations will help, and they will come and help your family too if they don't have time to shovel the walks or anything like that. So it's really good to get a team built up until the doctors have found out what works and doesn't work, so that you can live as close to normal a life as possible. You have to rely on these. So that's two of the things that I would suggest you do. Find those groups that will bring out people to help, even cleaning a house. I fractured a rib and I couldn't hardly get out of bed, and they came and they cooked for me. So there are those organizations. Use them. That's what they're there for. And the people who are volunteering want to help people. And then start to join the associations, and I can give you all this information, because it's, as I say, once again, it's a huge source of information from people who are living with conditions similar to yours, and they're usually up with the latest information.
Dr. Wilner, you've seen thousands and thousands and thousands of patients with epilepsy at this point. Based on everything you've heard from Dallas and Richard and Misha and her boyfriend, I apologize, I cannot remember your boyfriend's name at the moment.
Leon.
And how common is her case of epilepsy, or uncommon is it? Because I know when we were talking with Kim, it was a very unique case that had very few comparisons.
Yes. So, well, first I wanted to follow up on what Ali said. I was just about to suggest the Epilepsy Foundation. Their website is epilepsy.com, and they used to be called the Epilepsy Foundation of America, and they decided to internationalize, and so now it's just the Epilepsy Foundation. One very easy thing to look at, and I'd mentioned earlier, there's a list of these things in my book, but like home safety. There are very simple things you can do in your home so that if you do have a seizure, for example, I would tell my patients, if they're going to cook, they cook on the back burners. You don't cook on the front burners of the stove. At least in the US, we usually have 4 burners, 2 in the front, 2 in the back. You use the ones in the back because patients will sometimes have a seizure and fall onto the stove. Well, it's harder to get burned if you're using the ones in the back than if you're using the ones in the front. I'm a big proponent of microwaves. Those are a whole lot safer. There are things you can put on your plumbing so that the water doesn't get too hot. There are limiters. I've had patients who were burned in the bathtub. They got in the bathtub, they got the hot water running, they have a seizure, they don't turn it off, literally got burned in the bathtub. In the old days, patients would get burned in the fire. Every house would have a fire. And for cooking and heating, now we don't have that so much, but radiators can be very dangerous, and there needs to be something protecting you, something in between radiator. So, limiting stairs, you don't want to be going up and down the stairs, more carpets.
Little
Don't lock
rubber
yourself
corners on desks I've seen.
Corners on desks. Don't lock yourself in the bathroom. If you want to use the bathroom, you put a little sign on, occupied, because if you lock that door and then you have a seizure and then you're stuck between the toilet and the bathtub, which happens pretty regularly, nobody can come help you without breaking down.
We
never shut the bathroom door. Yeah.
Well, right. So you've probably already figured out a lot of these things.
Yeah.
But there should be an FAQ, on epilepsy.com. And there may be some, people you can write to regarding service dogs and closest epilepsy center and waiting times. And it might be a more direct.
Excuse me, doctor. I've looked
Yes,
into
ma'am.
a service dog, and it costs us about $10,000, and it takes a year to train.
That
And
sounds
then
like a
we
good
have-
deal.
Does it?
What I've heard
Yes.
before is 2 years and $25,000. So $10,000
Oh, is that
for
right?
1 year. That actually sounds like a that's the
A
best
little bit
I've
of a
heard
deal.
so far.
We're talking
Yep.
Canadian and American currency here. Let's not forget this. That's
Yeah.
a really good deal.
Yeah.
Well,
And Misha Medicine Hat is kind of a smaller center, and I have done a lot of research and done a lot of to get people to help her. We've had home care in, but they only last so long. We had to pay for caring hearts to come in, and they only last so long. And then it's just, there is not one person, not one area in Medicine Hat that will continue to come and help with Misha's situation.
So
I have
So
looked.
I would
again, I would emphasize that the real solution to this is stopping the seizures,
That's right.
and that's going to be your medical route. I have to move on to another meeting.
Can I
It's at
just
two
ask you
o'clock
one
my
question, doctor?
time, but yes, go ahead.
Can we be referred to a neurologist in Edmonton and Calgary from her GP in Medicine Hat?
I don't see why not. That sounds
Okay.
pretty straightforward.
Dr.
Okay.
Wilner, thank you so much for coming on.
Thank
I
you
really
very
appreciate
much.
your time.
Thank
Misha,
you.
good luck. Good
Before
luck
we
to you.
Questions?
There is definitely, I see definite potential for you to be a whole lot better than you are. So good luck to you. It was a
before
Okay,
we
pleasure
thank
all
you
meeting
so
you.
log off,
much.
Thank you very much.
Thank you
thank
very
you,
much.
Dr.
Thank you,
Wilner. I really
Jody, and thank
appreciate your
you, the
time.
other people.
Thanks.
Thank you.
So I'd like to do closing thoughts with our remaining people on the panel. I know, Ali, you had something you wanted to add, so we'll start with you.
I was just wondering, are you on AISH, Misha?
Yes.
Okay, and you've done all the forms that you have to when this, because it's changing over to ADAC? Great.
I
one
have done
thing
that all, Allie.
Okay, that's
I
fantastic.
have done it all for Misha.
That's
Yes.
fantastic. So I just want to tell you that there are also some organizations, if you're low income or no income, because you are not living with your parents, you're not a minor anymore, that you can look for funding, and your partner can get, if you've lived together for more than a year, your partner can get the tax breaks if he's supporting you and your parents. So you might be able to get help with that service dog. You may have to search for a service dog further afield in another province, but you can get on waiting lists, and it's a really good thing to do.
Okay.
And then we can look at funding. You can look at funding because if you're low income, you can get assistance for medical, and you will get, and you should be declaring all this on tax for whoever's supporting you. Are you working? I don't imagine you're working.
No.
Yeah.
No.
So we can talk. Jeremy can give you my contact, and I can see what I can help you with. But I just, I wanted to close by saying the EMS Safe Line is gathering all these stories. Have you submitted your story to Friends of Medicare?
No.
Okay, that's what I would ask you to do, because we can't really do anything about the healthcare system here right now. And you've got a really serious issue, and you're not getting the team that you need. It's not your fault, but it's not the medical profession's fault either. At this point, there's just not enough doctors, nurses, EMS, period. But what we're hoping to do is that we are hoping to gather all these stories and submit them to the Legislative Assembly, so that there's a record of what's happening now, and the people who are who are falling, in between the cracks, the people who are not getting the treatment and the tests and everything in a timely fashion. And if we can submit that to the Legislative Assembly, one is from the permanent records that no one can remove. So there is a record so that this never happens to other people in the future, but also it's going to apply a lot of pressure to them.
Okay.
Because they're privatizing right now, and who's going to pay for that, So again, I would reiterate, get your GP to refer you to multiple doctors if you can. They're not supposed to, but go into a walk-in clinic and get as many people filing for an appointment as you can. After a seizure, go to a walk-in clinic and say, I need a referral. And maybe that walk-in doctor will refer you as well as your GP, and one of them is going to get in before. Again, start calling that MRI clinic daily and saying, is there any cancellation? People are canceling all the time, but you have to call, they won't call you.
Okay.
And third, get some care, get the care you can. I know that people come and go. That's just the nature of volunteering, but have somebody there, because your family needs a break, you need a break, and get in the line for service dog. And then we can start to find out what funding is available for that service dog. And you can do lots of fundraising in your community to help you. People are doing GoFundMe to say, we need this for our daughter, we need this for our friend. And you'd be surprised how many people donate $50. That adds up. So those are all things that you have to do. And it's really criminal that you have to do the work and somebody else isn't doing this for you. But it's the reality of our system right now. And so we can contact each other, and as I get information, maybe I can pass that on to you after this show. And I'm so
Okay.
sorry that you're dealing with this. It's wrong, but you're not alone. And if you find those other people, it can help. It really can, because only people in your situation fully understand your loved ones. We don't understand. We watch from afar, and we are stressed and absolutely moved by what you're going through, but we can't, having not been through that experience, understand what you're going through. We can only view it. So be with other people, because they do make a difference, and you
Okay.
won't
So
feel quite
Ellie,
as isolated. Thank you.
are you in Calgary?
I'm in Cochrane, just outside of Calgary.
So can you meet with us?
I might. I mean, a lot of stuff is beyond my scope. I am simply, my mandate is to inform people of what's happening in the healthcare system. But I come into contact with a lot of stories, a lot of doctors. I'm kind of helping Dr. Parks gather stories. I worked for 5 years on the EMS crisis. I've met every MLA, and I met Adriana LaGrange, to a zero result of anything. So really what I'm doing in terms of advocacy is collecting the stories, and when I hear information, connecting people up to other things. My scope of research is limited, but I have, whoops, sorry, something fell. But I do meet with Dr. Luann Metz, the opposition health critic, and she was the one that took the EMS crisis to the Legislative Assembly. So I'm not sure. We could meet on Zoom, though. We can meet on Zoom and see what I can do and what I can't do, and I can try and help with information that I have. And I'm in contact
Right
with
now,
Aish
it's
as well.
very hard with a loved one,
It's
and
really, I understand that completely.
it is really overwhelming.
And I really understand that, and I've been there, so I know that there are groups for caregivers and family also. It may be by Zoom, but it really does help, and you shouldn't be alone, because as a parent, you wonder who's going to look after your child when you're gone. You wonder who's going to fund these things, and I get that completely.
Misha
So
does go to counseling, and she does go to massages. Misha does. We do mostly lots of. We try to do everything to make her comfortable. So she
yeah,
does go
that's
to
obvious.
counseling twice a month. She gets massages twice a month. But it's just overwhelming.
It
We
is.
need help. She needs help.
I understand that completely. And there are support groups, and I think that first would be to contact the Epilepsy Association. There's support groups for all groups. I mean, I'm working with some women who have stage 4 cancer, and they don't even have an oncologist. So the support groups are a way of at least being able to vent, to cry, to shout, to rage, to brainstorm, because it's not just that the person suffering the medical condition, it's everybody around them, because they're watching somebody they love go through pain. And it's very wearing and tearing on everybody involved. And so you need to take a break. And if I've learned anything, it's that you need to take a break too. And that's where friends and volunteers and service dogs come in to play. But you need to hear from other parents as well who get that. And also, my experience is that you get little tidbits of information that are just brilliant, that only people who are going through this know this. And they share these things that help everybody. And everybody needs to be in a group where, you can cry, you can sob, but you can also have a laugh, because you have to stay strong. You really have to stay strong. And that's where people who've been through it longer than maybe you have tips, but they also can bring a touch of, humor, and we all need to laugh and take a moment out. We need time out all the time. So that's what I would suggest.
So we'll ask our GP if
I
we
don't
can
think
get
the
referred.
GPs know. I don't think the GPs know, and they're also overwhelmed.
Just to be referred to the Foothills Epileptic Clinic.
Is that the nearest one, or is Edmonton the nearest one?
No,
Calgary.
We can exchange this information of what's out there after this podcast. But also, I would try, honestly, people are trying anything. And I would try, the next time you have a seizure, go to a walk-in clinic first, or the urgent care if you have one in Medicine Hat. I'm not familiar with what's there. But go in and ask those doctors to refer you, because if you've got 3 or 4 doctors referring you, you just go to the first person you get, the first neurologist that you get in with, and you can cancel, because they love it when people cancel because they're overwhelmed. They've got bookings 24 months in advance.
Ali, I really
So that-
appreciate you
yes,
coming
I
on.
hate to
Thank you
say
so
Thank you
much.
very much, Ellie.
Yes,
We're
thank you
out.
so
We're
much.
out of time. Just because I'm going to end the podcast does not mean you all have to disconnect. If Ali is willing, if you have any more questions after, but I do have to end the podcast because when we
Sure.
go over an hour, viewership tends to plummet off.
I know.
But
Thank you
thank you
so
so
much,
much,
Jeremy.
Ali. I really appreciate you coming on and everything that you are doing for people in Alberta.
I really appreciate you doing this, Jeremy, because it's getting the word out, and we're not alone. For every
Well,
one person, there's hundreds.
thank you. I mean,
You need to know
Epilepsy
that.
Awareness Month is in March. So
Yes.
let's all keep that in mind. And I do actually have another person with epilepsy who already wants to come on and who has their own horror stories to tell from what I'm hearing. So, and I really, Ali, what you're doing is so important because you are the I am the media voice, but you are the voice that talks to the government, and that is, in my opinion, monumentally more important because these are the people that need to make the changes. And I can sit on my podcast and yell and scream all I like, and all they have to do is click the next video if they don't want to hear me. So what you're doing is substantially more important, and I really do appreciate you very much.
Well, I appreciate you very much too, Jeremy. So thank you.
Thank you. Thank you
Thank
very
you,
much.
Thank
Dallas.
you.
Thank you, Misha.
Thank you so much.
This is a politically centered podcast.